Is bacon bad for your heart? Have you ever wondered if that crispy, savory bacon is doing your heart any favors? Let's break down the facts about bacon and heart health. Bacon is a processed meat that contains a variety of fats. About 50% of the fat in bacon is monounsaturated fat, which includes oleic acid. This is the same heart-healthy fat found in olive oil. However, bacon also has around 40% saturated fat and about 10% polyunsaturated fat. Now, saturated fat is often a topic of concern when it comes to heart health. It can raise low-density lipoprotein cholesterol, commonly known as bad cholesterol. This type of cholesterol is linked to artery clogging and heart disease. But here is where it gets interesting. The connection between saturated fat intake and heart disease is not as straightforward as many believe. Some studies suggest that saturated fat may increase certain risk factors, but a consistent link to heart disease is not always clear. Another factor to consider is the cholesterol found in bacon. Recent research shows that dietary cholesterol has less impact on blood cholesterol levels than previously thought. However, bacon is also high in sodium due to the curing and processing methods used. High sodium intake can raise blood pressure, which is a major risk factor for cardiovascular disease. Processed meats like bacon contain preservatives and compounds formed during curing and cooking. These include nitrites and nitrosamines, which have been linked to increased cancer risk and may contribute to inflammation, a factor in heart disease. Large observational studies indicate that consuming 150 grams, or about 5 ounces, or more of processed meat per week is associated with a higher risk of cardiovascular disease and mortality. This suggests that frequent or high intake of bacon could increase heart disease risk, mainly due to its processing, salt, and saturated fat content. From a health and healing foods perspective, moderation is key. If you love bacon, it is best to consume it in moderation, especially if you are concerned about heart health. Opting for whole, minimally processed foods with lower sodium and healthier fat profiles is a better choice overall. If you do decide to enjoy bacon, consider limiting your portion size and how often you eat it. Cooking methods can also make a difference. For instance, microwaving bacon instead of frying it can help reduce harmful compounds. While bacon does contain some heart-healthy fats, its high saturated fat, sodium, and processed nature mean it can contribute to heart disease risk if consumed in large amounts or frequently. So, enjoy your bacon, but keep it balanced with a variety of wholesome ingredients for health and healing.